Toothbrushing is not just a cosmetic or an aesthetic activity that we do to improve our grooming. Rather, it is an important hygienic activity that helps us to, among other things, maintain our oral hygiene. Over the past few decades, scientists have been able to establish a relationship between the brushing of teeth and the onset of heart disease. And the link between the brushing of teeth and heart disease is the presence of periodontal disease. Periodontal disease is a disease that affects the gums, and in its early stages, it can present as gingivitis, which is the tenderness and the swelling and the redness and the bleeding of the gums when we brush. Now, in its later stages, this can present as retraction of the gums from the teeth and loss of bone in the jaws that eventually leads to the loss of teeth. Now, scientists in this study were able to show that the brushing of teeth to prevent periodontal disease is important not based only on its frequency, but also on the time of day that brushing actually takes place. What they did was that at their university hospital, the Osaka University Hospital, they enrolled 1,675 patients aged 20 years or more who were admitted to the hospital for surgery or just a plain examination or medical treatment. And they divided these participants into four different groups. Group MN, or morning and night group, was the group of patients who brushed their teeth after waking up and at night. And in this group, there were 409 patients. The night group, group night, included those participants who brushed their teeth only at night. 751 individuals were included in that group. In the group M, or the morning group, which included those participants who brushed their teeth only in the morning but not at night, there were 164 people. And finally, the group none, or the control group, in which were placed those people who did not brush their teeth at all, there were 259 people. Now, the scientists followed these people over a period of 3 years. And during that period, they were looking for the onset of cardiovascular diseases, heart diseases. And among the heart diseases that they were looking for were diseases such as heart failure, myocardial infarction, which is a heart attack, arrhythmias, irregular heartbeats, chest pain that required bypass surgery, valvular heart diseases that required surgery, and diseases of the big artery of the heart, the aorta, that required surgery. Now, when they analyzed the data from these groups of patients, what they found was that the group of patients who included those people that brushed their teeth both in the morning and at night, and those who brushed their teeth at night, those two groups had a hazard ratio that was around 0.5. And I'm going to explain what that means. Now, a hazard ratio is a comparison of the incidence of heart disease, how often heart disease arises in a particular group compared to the control group. And in this case, we can see that for the MN group, morning and night group, their hazard ratio was 0.59, and the hazard ratio for the night group was 0.55. So these data tell us that by brushing their teeth in the morning and at night, these patients were able to decrease the risk, the probability of developing heart disease by almost 50%, by almost a full half. And if we look at the p-value, which tells us whether or not these figures are purely by chance or whether or not these findings are real, we see that the p-value is 0.021 and 0.004, which is less than 0.05, the traditionally and the usually accepted cutoff for p-values, which signifies and which confirms that these data are real data. And therefore, we can see that compared to those people who did not brush their teeth, those people who brushed their teeth at night were able to decrease their risk of heart disease by almost 50%, almost a half. If we look at the morning brushes, right here, what we see is that the p-value is 0.66, which tends to suggest that there was no statistically significant difference between this finding and the control group of people who did not brush their teeth. As the scientists further divided the group based on their smoking habits, what they found, even more surprisingly, was that the group of smokers who did not brush their teeth, right here, this group, the brown on this graph, had a significantly higher risk of developing heart disease than the other groups. These three here, the group of people who brush their teeth morning and night, group who brush their teeth at night, and the group who brush their teeth only in the morning. So that having been said, how often, what is the ideal frequency for brushing our teeth? Well, it is recommended that we should brush our teeth at least twice a day. And as you can see from the study, most importantly is to brush your teeth at night. Brushing our teeth is not just a matter of aesthetics. Brushing our teeth is an activity that can significantly impact our lives and our health. I hope you liked the video. If you did, please leave a comment in the box below, hit the like button, and support the channel by subscribing. Until the next video, stay healthy and stay safe.